in the heart of Yorkshire. Our health service is hard at work.
Barnsley A&E.
Just waiting for that bed to be ready.
Your double room, your sea view.
A dedicated team working around the clock in Casualty.
Will somebody do me the next transfer, please?
Thank you, loveliness. Anything else hurting?
Yeah, my feelings.
Nice to meet you, sweetheart. If it's all tapped up for you, ask somebody else.
They're with us for our most vulnerable moments.
There you go.
You're being braver than your mum.
That tastes nice. No, oh, bless you.
Facing life and death.
You either want to live or you don't.
Trauma and tears.
I think there's quite a chance you've broken your hip.
Supporting each other through the toughest shifts.
You're my favourite.
Kia.
This is Barnsley Casualty 24/7.
Gonna send you home.
You're far too cheerful to be an A&E.
Somebody will realise me.
I love you.
On shift tonight, Sister Jane Hawksworth,
Oh my God, where's my 91-year-old?
Junior Dr. Dean Mart,
You won't remember anything about it. How's that sound?
Junior Dr. Patrick King,
Pressure up to 123.97.
Can we get a trolley in here, please?
and Registrar Dr. Dan Buick.
I think you're having these episodes where your heart is playing silly bugger.
So get ready to spend the night at Barnsley Casualty.
Jeez, is it only 9 o'clock?
It's 7 p.m, the start of the night shift.
Got a tissue in the dryer.
But it already looks like it's going to be a tough 12 hours for the casualty team.
I've got 70 patients down here, 14 are waiting for beds. My only thing is I have no flow. So I've got patients still coming in, but I've nowhere to put. I've got an ambulance on the back.
Sister Jane's running the hub.
I know. My concern at the minute is I've still got ambulances coming in and nowhere to put them, yeah.
She's clocked on to find every bed in Barnsley Hospital is taken, making casualty gridlocked. But new patients keep arriving.
I've got one on the back corridor, one on the way in, but I've just had an influx of 3. All right, bye-bye.
To get the department moving again, Sister Jane and the close-knit casualty team will have to pull together.
Oh, thank God you're on with me tonight.
Does she need any more fluid, Rob, or are you happy with the litre that she's
No,
had?
she needs some more.
It's hard when you're in charge because you have people coming at you from all directions. You'll have doctors, nurses, colleagues. You need to ring back to the hospital and ask them to put you through to intensive care. They're just all at you.
You know, there's 4 nurses working it up, so I've asked them, one of them to come and help me round here. They just keep leaving me. So
You just need to keep asking them, darling, because I can't keep running, you know, to get somebody to help you. When you've got 70 patients in the department, it's hard, and I suppose I can come across as maybe a little snappy. It's not about having authority, is it? It's just about asking somebody to come and help you. I'll get them to come and help you. They know that my barks are far worse than my bite. No, it's just 1 in, 1 out, because I have no beds and there's just no flow in the hospital.
It's only 18 minutes into the shift when Junior Dr. Patrick King receives a critical call.
Hello there, Barnsley A&E. How far away are you? 5 minutes. All right. I'll make sure we're ready, Rhesus.
An ambulance is rushing in a 77-year-old man. He's got a history of heart problems, and now he's showing signs of a heart attack.
In here. Hello there.
Just got his blood pressure up to 123.97.
Can we get a trolley in here, please?
Dr. King and Sister Harriet Lindley get a handover from the paramedic.
Central radiates back, neck and both arms. Had a heart bypass about 12 years ago, has hypertension, type 2 diabetic, down to like 60 something after GTM. So after GTM. So lethargic, short of breath.
Yeah.
Bear with me.
What's his name?
Barry.
Hello, Barry. My name's Patrick. I'm one of the doctors here today. I'm just going to get you all settled in, do some tests. Deep breath.
Short of breath.
And out.
Chest shallow, 24, but there is air entry. He's had a cough, he's a smoker. Urine's been fine, eating and drinking's been reduced. He last ate something yesterday, he's only had a cup of tea today. He's got a stoma from ulcerative colitis.
Do a full flow lead here and we'll assess the face stop lines. If you want to get hooked up, observations, please. We'll see what we get.
The ECG will read Barry's heart rhythm. An irregular one could indicate he's had a heart attack.
You alright? I'm one at nurses. Just gonna pop some leads on.
Barry had a bypass 12 years ago, so he's at high risk of a heart attack.
You just be able to give me a shout out loud when we get any readings, Harriet.
It's going up 200 and something, so I think he's struggling to get it.
Okay, we've got access.
Wife and daughter are on the way.
How are you feeling?
Have we had another 12 lead ECG?
35-2.
Yeah, that's yours.
That's ours. Thank you.
As Dr. King goes to discuss the ECG with consultant Dr. Liz Doherty,
He's definitely got his ECG, hasn't he?
Barry's family arrive at his side.
What's your name? Cameron. Yvonne, okay. We're just getting all monitoring on him at the moment. We're taking his bloods and we're just doing all ECGs and we're looking at him now and then we'll let you know when we...
Yeah, that's right.
You can talk to him if you want to hold his hand.
My name is Patrick, I'm one of the doctors here. Where we're at the minute is he's got a few changes on his ECG, which we're concerned could be from his heart due to some ischemia or a heart attack, okay? We've had a re-look through at the pictures now, and we're just deciding what's going to be the best place to have him seen in. We can treat him here with medications, or there is the cardiologist over in Sheffield, so it may be that he's a lot better going over there than continuing to stay under us. So our consultants just got onto the phone to them.
Yeah, his blood pressure's been low, yeah, it's picked up a bit with a bit of fluid.
So far it's a case of keeping an eye on him, keeping that blood pressure stable and seeing what the red bloods are going to show us.
Yeah, he's conscious and his blood pressure is around 90, 50.
The paramedics are on standby. If Barry's condition deteriorates any more, he'll have to be blue lighted to the heart specialists at Sheffield Hospital. It's a couple of hours into the night shift.
Jeez, is it only 9 o'clock?
Sister Jane's trying to stop Casualty grinding to a halt. There are no beds available on the wards, and patients keep arriving.
She said that there were no ambulances due. Well, we've just had 3 in. There's one on the back corridor and 1 due.
She's updating consultant Dr. Anita White about the bed situation.
She thought there was only 12. There's actually 14 patients waiting for beds. Oh, I could cry. I swear to God, I could cry.
In Resus Bay 2, 77-year-old Barry and his family are waiting to hear if he needs to be sent urgently to Sheffield's cardiology unit. In order to keep infections at bay, Sister Harriet gives Barry some medication.
Giving you an antibiotic, Barry. Are you allergic to anything? No. How do you feel, Barry?
Dr. Doherty has had a call from the cardiology unit.
Okay, yeah, thank you very much. They don't think it meets criteria. they're happy to hang fire, and I said I'm happy to. They haven't. So actually, he's settled. His pain's gone, and this looks less ischemic.
Yeah.
With Barry now staying at Barnsley Casualty, Dr. King is back with some positive news.
Okay, Barry. So I think the answer is that you're going to be staying with us for the time being. Okay. We've had one of your blood tests coming back now, and that's not looking too bad. Okay. That's a blood test that we call a troponin. Now, if there'd been any damage through to your heart muscle, this troponin is how we detect it, and it goes shooting up in the blood. Okay? In your case, the troponin is very slightly up, and which doesn't point towards it being something very big going on straight away. So we can look towards getting you admitted in here and getting you up for a proper bed. Have you had anything to eat at all? Do you want something? Do you want a drink of anything? You want a coffee? Sure, we can order.
I'll have tea.
Huh?
Tea.
I'll have tea.
Tea? How do you like your tea?
No sugar.
Look, no sugar. Same as me.
Because of the shortage of beds across the hospital, for now, Barry has to stay in resus. In the hub, Sister Jane is trying to move patients from Casualty to beds that have been recently freed up on the wards.
Katie, have you gone? No?
No, we can't. Have you chucking it? She's on oxygen and whatnot.
Resus is just rammed. I need to get some patients out to resus. There's 3 that can go up to the ward.
After nearly 2 hours in resus, they found a bed for Barry up on the ward. He spent 2 weeks there recovering.
Has the porter come back with a bed yet? No.
In the hub, it's Nurse Chloe's first night back on duty since being a patient in Casualty.
So I'd laid in bed. I had one dog in bed with me and one dog at the side. So I'd gone to give him a kiss, and he'd then bit my face. That was the inside of my lip.
I think it's gone inside.
Yeah.
Okay.
But as he was injecting the local in, I could taste it. I was like, oh my
Yeah,
god,
oh, yeah.
this is. He's gone for me before, but nothing like this. It could have been a kid.
Yeah.
At least it was me. After a long debate with myself and other people, we made the decision that it would be time to take Oreo to the vet. And there's no point sitting at home feeling miserable for myself when I could be at work and making a difference for other people. I think it makes me able to empathise with patients a lot better, because I actually know what they're going through and how scared they are and what their pain is like.
Nurse Chloe is now in resus. She's treating 26-year-old Kaylee, who's come in with a dislocated shoulder.
It's so scary every time.
You've got the best nurse, don't you, to be scared? Does it come out often?
Yeah, it does.
Have a seat, darling.
Mum Tracy has brought her in.
How's your pain? Out of 10?
7, 8.
Dr. Mark will be treating Kaylee, who suffers from hypermobility syndrome.
How many times do you know?
Just count.
Really? That many?
Yeah.
Okay, that's good enough for me.
Maybe 30, 40.
Really?
Which means her joints are looser and stretchier, so prone to dislocate.
So it should be relatively easy to get back in place?
It's just keeping it in place once it's
Yeah.
back in.
Yeah.
Dr. Mark will need to manipulate Kaylee's arm back into the shoulder socket, which can cause excruciating pain. She'll be given pain relief to inhale.
Just gonna keep it nice and simple. There's no sort of,
Okay.
no dramas.
Yep.
We know that anxiety plays a big part and has a big role in patients' pain thresholds. In treating patients who have pain, simple explanations of what is going on alleviates that anxiety. You keep breathing. So I'm going to do is just expose this a bit, yeah? Not doing too much.
Ow.
Okay, nice, let's keep
No.
breaths. Keep breathing. I'm not going to do too much. Just go floppy. Relax. Okay.
Do you want me to hold this for you? And you can hold my hand. If you break it, I can go home. Is it your challenge?
This arm is a lot of spasm, isn't it? Yeah? Chloe, would you mind just supporting that for a minute? I'll just get the alpha-fentanyl and I'll just give it a bit. We'll see if we can... Okay, that's going to give you a little something, the good stuff. Yeah. This makes you feel just a little bit woozy. So in a minute, you'll feel a warm flush come over you. Okay, sometimes your nose goes a bit itchy as well.
It hurts. Ah, you're hurting it. You're hurting my shoulder.
Okay.
Open your mouth and keep breathing.
That's it. Go as sloppy as you
Ow!
You breathe away. Okay, you're doing really well. You're doing all right. Hmm?
Yeah.
Yeah.
Do you?
Go floppy.
Ow! Ow!
Okay. No. Okay.
Okay.
Okay. Should we stop there?
Sorry.
No, you're doing all right.
It hurts.
That's fine. I tell you what, I don't think she's just in too much spasm.
I'm sorry.
Don't apologise to me.
Sorry.
That's fine.
Go sit. We do it all at your pace, okay? We're not in a rush. We're here all night.
We'll put this back on, and then we'll do it another way. Yeah? How's that?
With the procedure causing Kaylee too much pain, Dr. Mark needs a plan B. In the hub, Sister Jane is waiting for beds to be freed up on the wards so she can move patients out of the gridlock casualty. But more poorly people keep arriving.
How many walk-ins are there?
With no patient flow, waiting times are on the rise. So Sister Jane's also having to deal with frustrated patients.
You have to wait up to 4 hours, but that doctor wait time may go up dependent on what comes through the door. We've just got some really poorly patients in resus at the minute.
But something has put a smile on Sister Jane's face.
Have you seen these tonight? No, don't you get excited, doctors. I don't believe they're for you. You know that paramedic last week?
Oh, yeah.
He brought them in for us. They were lovely. So anyway, they're going to be placed here, but they're not for you. No, somebody's brought them in and said they're for the nurses only. What?
No, you know what? I don't even like Casualty Street. But now you've said that, it's like tempting me. Like every time I look at it, I'm like...
I'm telling you.
But junior Dr. John Shepherd has no time for treats, as his next patient is waiting in cubicle 6. 24-year-old Craig has been brought in by his mum Janet after having an accident outside his home.
What has happened to you? So I was coming in from work and I'm climbing over a fence, 6-foot fence, and I fell straight off of it, straight onto my side.
What did you fall onto?
Concrete.
Concrete. Fine. So presumably this side before.
Yeah, straight onto me.
What have you hurt?
All down here.
Okay.
And I can't feel any pressure on my leg and my hands.
Okay. No pain in your tummy? No pain in your chest? No pain in your neck? No. Have you banged your head?
No.
As best you can. Can you set up to about 90 degrees for me? Sorry.
Dr. Shepherd examines Craig to assess his injuries.
Anyone want to do that? We'll do that. Sorry, mate. Okay. Why were you climbing the fence?
Because my partner was at work, I told her to leave keys on window.
Yeah.
And I've gone flying.
Next time.
Yeah,
Plan B.
yeah.
Plan B next time.
I'm just going to get some more keys, bro.
Yeah, I think that's pretty fair. Would you mind getting your trousers off?
No, that's fine.
Try and relax your right leg as best you can. Is that really sore? How's you feeling in your foot?
Quite numb.
Quite numb? We're going to get an x-ray of your pelvis, an x-ray of your femur, which is that on bone in your leg. Before I do that, do you mind if I take some blood from you and we will give you some morphine? Is that alright? But that's the only bit I'm worried about at the moment. If you have broken your femur, it normally involves some metal work. Equally, if you've done something serious to your pelvis, that's normally a repair job as well with some metal work and stuff.
Impact injuries from falls can result in complex fractures. If Craig has smashed his pelvis, it would take major surgery and 3 months recovery time.
You opened it. You can do.
In the hub, Sister Jane and Sister Vicky have opened the chocolate gift for the nurses.
They were massive then back in the day, weren't
Oh,
they?
yeah. They were like that. Toffee penny. Tins were bigger and all.
They were. Back in the day.
But Sister Jane is too distracted by the bed situation to keep a close eye on the nurse-only treats. Casualty is still snarled up with patients, but that doesn't stop emergencies heading to the department.
Hello, ED Barnsley. Hiya, yeah. 90-year-old male, yeah?
Paramedics are rushing in a man who's suffering from severe breathing difficulties. He's taken straight to resus, where Nurse Chloe is waiting for him.
Hello, my darling. Are you ready? Hello, sweetheart. I'm just going to take you these off and stick you some fresh ones on. These leads are a bit cold. I'm sorry.
Dr. Buick is assessing Stanley.
Stanley? My name's Dan, I'm one of the doctors. How are you doing? Not well. In what way aren't you well, Stanley?
Can't breathe.
Can't breathe. How long's that been for? Any pain? In your tummy? Quick listen to your breathing.
Nurse Chloe needs to insert a cannula to take bloods and administer Stanley's medication.
Sharp scratch coming, Stanley.
Thank you. Sorry.
Well done.
Done, finished.
Done.
Breathing problems could be caused by a blockage in the main artery, stopping Stanley's lungs from working properly.
Stanley, I want to scan your tummy just to look at the main blood vessel. Is that okay? Hi then.
Jean, Stanley's wife of 70 years, arrives,
Your wife's here, Stanley.
followed by their son John.
Stanley's not feeling very well. Do you know how long has he not been well for?
2 or 3 days. Okay. You know when it starts, it's like he's in a panic attack as well. You know what I mean?
Okay. Stanley. Stanley.
Dr. Buick needs to diagnose Stanley fast before his breathing deteriorates any further. At Barnsley Casualty, a bed shortage is putting the team under pressure. So they need an injection of their own.
Did you see his coffee yesterday? It looked like gravy.
It was good gravy.
It looked like gravy.
Did you have some?
No, I didn't. On a night shift, everybody's hyped up on caffeine. The band is really good. Everybody's a bit sleep deprived. So there's always a bit of hysteria and a bit of a laugh and a joke.
What do you want, Cock? Earl Grey? I ain't got any tea leaves, I'm afraid.
Cappuccino, please.
Who else? I feel like I'm at Costa. Does look fake, doesn't it?
My God, it's like that.
Go on, no.
Yeah, go on, I'll have it.
In Resus Bay 3, Dr. Buick is still treating Stanley, who was rushed in with severe breathing difficulties.
This afternoon, I couldn't breathe at all.
Right.
His wife Jean and son John are by his side.
Should we try sitting you up a bit? Will that help with your breathing?
Yeah, that's better, that's it.
Where to?
Yeah.
Yeah?
But that's for a pacemaker.
Okay.
But we never heard no else about it.
Why did you have tests for a pacemaker? What was happening? You know?
Generally saying problem.
Have you passed out at all when you're feeling unwell like this?
No.
How long does it last for?
What time did it start, G? Well, when you went to bed last night. He come downstairs at 10 o'clock at night and he were bad. And we went a bit better, you know. So he got down in a chair, recliner, and I went to bed. Then I saw a light on, so I come downstairs. That'd be 1 o'clock this morning. And he says it's come on again.
Okay.
This afternoon was really bad.
Mm.
I've no control over it.
Yeah.
It's just got me late. I can't stand up, I can't do nothing.
I'm going to go and have a look at your previous discharge notes from when you were in before. I'm going to request a chest x-ray as well, alright? And then we just need to keep an eye on your heart rate, because it has been going quite quickly at times, and then settling down again. So that's what I want to have a look at.
I think it's all arrhythmia, so I think he's tachycardic. He's having little runs of tachycardia that push him into failure a bit, potentially.
With a risk of heart failure, Stan still isn't out of danger. In the hub, Sister Jane is still searching for ward beds so she can free up treatment bays in Casualty.
Right, lovely. How many beds have you got? 2 male. Okay, darling, that's lovely. Thanks, sweetheart. Bye.
Also in resus is Kaylee. She has hypermobility syndrome and is still in pain from her dislocated shoulder.
Don't upset, darling. Sometimes these muscles just need to relax a little bit. Okay.
She's being looked after by Nurse Chloe. Dr. Mart has spoken to the orthopaedic team, and together they've come up with a plan to get her shoulder back into the socket.
It's going to give you something a little bit stronger. Okay, so you won't remember anything about it. How's that sound?
I don't remember it. My mum said I just told loads of crap.
That's not a bad thing. Okay, good. Mum, so we're going to send you out. Chloe, can I ask for a bit more Alfent and a bit of Propofol, please?
The muscles in Kaylee's shoulder have been contracting so much, it's already prevented Dr. Mart from pushing it back in. It means administering a general anaesthetic.
Okay, this is Rob.
Hello.
Assisting Dr. Mart will be Registrar Dr. Rob Cornford.
Sorry.
She apologises all the time.
I'm sorry.
But that's all right. So your job is to be as comfortable as you can, okay? So where's your husband at the minute? Oh, right.
My husband passes out at needles, so I don't even know that. Ow.
Kids, Shahul?
No.
Yeah, is that a boy or girl?
Boy.
Boy, yeah.
Girl at 6.
Yeah?
Boy at 3. Ow! Ow.
Yeah?
The girl at 2.
Oh, so you staggered them nicely? Was that all planned, obviously?
It's making me feel a bit fuzzy on my
That's
face.
all right. That's absolutely fine. That's exactly what we want.
The general anaesthetic is starting to take effect. The team must now work quickly to push her shoulder back into its socket before it starts spasming again.
Chloe, do you want to give Rob a bit of counter-traction? We're going to come on that side and maybe just support her head and neck,
If they don't succeed, Kaylee won't have any chance of getting home to her 4 young children tonight. In the hub, Sister Jane has been so busy finding beds for patients, she hasn't had a break.
Do you want to go for a drink?
No, have you been for one? Well, I never bother. I just normally go for my tea at about 5 o'clock. 5 o'clock's coming round quite quick, isn't it, at midnight?
I'll wait for my tea.
What have you brought?
Spaghetti oops.
In Resus Bay 3, Dr. Buick is still trying to diagnose 90-year-old Stanley, who was brought in by ambulance struggling to breathe.
How are you feeling now, Stanley? Do you feel any different?
Not bad, bit better. Just can't breathe.
When you're well, how far can you walk?
He goes to walk on lane every morning with dog.
He washed his car on Sunday morning.
3 hours he was washing that car. It's like a new one again.
We'll get you out of here and you can come do mine. I think there's always a role for humour and just trying to make them feel a bit more relaxed. This may be the worst day of their life, and if you can improve that in any way, just sharing a joke with someone is a very human thing to do.
Dr. Buick thinks Stanley's illness is linked to his heart, but has requested a chest x-ray to rule out any problems with his lungs. The x-ray is clear, so Dr. Buick is reviewing Stanley's discharge notes from a previous hospital visit, weeks earlier.
I think your heart's in a normal rhythm, and then I think from time to time, the rhythm is changing, and it's going very quickly, and that's what's making you feel poorly. Reassuring things from me are that your heart rate at the moment is normal, your blood pressure's a little bit on the low side, but it's not dreadful, your oxygen levels are normal, but I think you're having these episodes where your heart is playing silly bugger.
I feel all right. And I have one of these attacks, and bad what it is.
We probably need to keep you attached to a monitor to see exactly what's happening. And I know in the past you've had 24-hour ECGs looking. We might need to do something like that again to keep an eye on exactly what's happening when these symptoms come on. We'll get you into the other part of the department, and I'll come and see you in a while when I've got your blood tests back.
Stanley spent 3 days in hospital, and he's on a waiting list for a pacemaker. In resus, Doctors Cornford and Mart are still trying to reinsert Kaylee's shoulder into its socket.
That looks different to what it was earlier. Feels all right. Let's just... Yeah, that's it. Kaylee? All done? Okay, marvellous. Should we get your mum in? We'll send you for an x-ray in a minute again. Just make sure it's in. Is that okay? Any questions, mum? No? Okay. That's all right.
As Dr. Mart's shift comes to an end, Kaylee heads to radiology.
Right, that's it, we're all finished.
In the hub, Dr. Cornford checks the x-rays to see if the dislocation has been fixed, as Kaylee is wheeled into cubicle 4 to recover.
How does your shoulder feel now?
So,
Can I have a little feel? Is that alright? Can you still feel me touching your foot?
yeah.
It definitely looks better. It doesn't look perfect, but it may be that that's just how your shoulder fits and it's in and out all the time. I'll speak to the orthopaedic doctor and get him to come down and have a look and a chat. Is that alright?
Yeah.
The orthopaedic doctor agreed that Kaylee doesn't need to be admitted tonight and can go home to her 4 kids. Kaylee had surgery 2 weeks later, but her shoulder has since popped out again, twice. She's now been referred for further consultation. In cubicle 6, Craig, who fell 6 foot onto concrete, is being sent to radiology.
Oh, this side.
The concern is he may have broken his femur or pelvis.
So a deep breath in, Craig. Breathe all the way out. Stop there. Breathe normally now.
With Casualty being so busy tonight, cubicles are in high demand, so there's no option but to park Craig in a corridor. In the hub, Dr. Shepherd is looking at his x-ray results. And it's time to deliver his findings.
I'll be around the corner. I can't see any broken bones on there. So, that's a good thing. But can I have a look at this leg? Because I just want to figure out exactly how funny it's feeling. And therefore what we need to be thinking about is going on. It's still feeling funny in this foot.
It's quite numb.
So you can still feel it, but it's just not right.
Yeah.
But with Craig still in a lot of pain from his fall, Dr. Shepherd wants to investigate further.
Okay, fine, I'll stop talking, alright. So we're going to get you a CT scan. In the meantime, before we've got the scan, can I lie you completely flat?
Yes.
Because if there is a problem with your back, that'll just make it a bit more protected than it is with you sat up. Then you've got some morphine coming, alright?
Well, I get that before.
Yeah.
No, thanks.
We're cruel, we're not that cruel. Alright?
No, man.
Got some morphine coming, and then with the scan she'll give us some more answers, alright?
With no broken bones, a CT scan could be the best way to identify the reason behind Craig's excruciating pain. It's the middle of the night, and there's no slowdown in the ambulances arriving at Barnsley Casualty.
Hello, madam.
Hello.
Let's go for a ride.
Come on with us.
Nurse Millie Schumacher is in ambulance admissions. Her next patient is 81-year-old Clifford.
So he's taken Friday morning meds as well as today's.
Yeah, then around 45 minutes after taking them, started with headache and abdo pain.
Having double dosed on his prescription medication, Clifford is now feeling the side effects.
Being a bit unsteady on his feet as well.
Hey Clifford, how have you managed to take your extra tablets?
I took the tablets at 5:20
Yeah.
and then I'll get them out for next month.
Yeah.
Put them in my hand.
Yeah.
And then I've forgotten what I'm doing. I've had tonight and tomorrow's.
Oh dearie me.
I have to be more careful with the temperature.
Yeah, you should.
Overdosing can affect kidney function and cause heart rhythm problems.
What's the temperature, Clifford?
Right to middling. It's like a cinder joint. I can't afford all them tattoos.
Why, do you want some tattoos? Have you?
Some real.
Oh. When did you have that?
When I was drunk in Air Force.
When you were drunk in the Air Force?
About 1958 in Blackpool.
Let's have a look then. Very good. Right, what tablets did you take then, Cliff? Have you got any pain then, Cliff? You've not got any chest pain though, have you? So it's just your headache. Yeah? Forehead.
The team needs to work out if Clifford's severe head pain is from taking an extra dose of tablets or if there's a more serious explanation. With Barnsley Hospital almost full to capacity, it's been a long night for Sister Jane and her team, and they're all in need of a bit of TLC.
But yeah, we can. I'll be passing out, I'll be fainting. You've got had your head, haven't you? Yeah. Have you blow dried that, yeah? As a team, we do hug each other. We are quite touchy-feely. I think the whole nature of being a nurse is that you're compassionate. You wear your heart on your sleeve, and it makes you feel better. I know.
In ambulance admissions, Nurse Millie is still trying to get to the bottom of Clifford's severe headache.
We'll get you in a room and switch the lights off then.
He's feeling sick and suffering from a blistering headache. But with more and more patients coming in by ambulance, Nurse Millie is moving him to Bay 5 of the hub.
There you are, all right, Cliff. Switch that light off for you.
There you go. Yeah. Right, I've got you some pain relief here.
Next, auxiliary nurse Sarah Dawson arrives to check Clifford's heart rate.
Right, Clifford, we're going to be doing an ECG, love. So I'm going to have to lift your t-shirt up, pop some stickers on your chest, your arms and your shins. Right, I must apologise, my hands are cold.
Warm out.
I don't know about that. My other half says it's an empty cavity.
That's sticking in the air.
What's sticking in
It's
my
a
ear?
pen, is it?
Oh, my pen. Yeah. I never lose it if I keep it there. Trouble is though, I forget and on my way home it's still in my head. Right, let's get you hooked up.
You are an electrician.
No, I'm not an electrician.
You're not good on that job if you come up down here.
That's true. Right, lovely, sit nice and still for me. Right, Matt. Right, love, all done. Bye.
Clifford's ECG is clear, so after nearly 3 hours, he's able to go home. In the hub, for Sister Jane and the team, the end is in sight.
Oh my God, we're into the last hour, come on.
But she still has work to do, getting patients into the last few beds.
So I've got a 91-year-old lady that I'm going to put on a bed. Where's my 91-year-old?
In cubicle 8 is Craig, who fell off a 6-foot fence onto concrete. He's waiting to go back to radiology.
Is that painful to lay down?
This time, it's for a CT scan to see if his pain is being caused by serious nerve damage.
Right, Craig, the scanner's going to start.
Hold your breath. Breathe.
That's fantastic, we're all finished.
In the hub, Dr. Shepherd is checking the scan results.
So we've just had a quick look through and I can't see anything significant. The amount of pain you're in, and we want to make sure that leg is improving in terms of where it's known. So yeah, certainly tonight, and we'll have a look at things in the morning. Brilliant, no worries.
Right, so because I'm working down in one.
That'll be wrong in bed.
As Mum Janet heads home, Craig is on standby for a hospital bed. He was seen by an orthopaedic specialist the next day and was told he'd had a lucky escape with just severe bruising. It's the end of the shift, and it's been one of the toughest Sister Jane can remember.
The whole hospital, we broke it proper tonight, haven't we? Hello, hello. One of the worst nights I've ever known in my life.
She has one last job to do, to brief the oncoming day team.
The acuity of patients has just been horrific all night. I've bedded down who I can, but there's no beds in the hospital. There's probably about 30 patients in the department.
And it's home time for the rest of the team.
I think A&E's a great family. We pull together when we need to, we argue when we need to, and then when stuff goes wrong very quickly, we pull together and get it sorted.
See you later. Bye, Ian.
It might have been one of the toughest nights Sister Jane has ever done, but despite the challenges, she'll still be back at Barnsley Hospital for her next shift.
Because we are all in that caring profession. That's just how we are.
Next time on Casualty 24/7.
I need another nursing resource, and I have nobody. Oh, are you smiling?
Sounds as if I'm on the way out.
My brilliant mocha chocolate lattes, what they call them. Them fancy coffees.
Catch all that new next Wednesday at 9.
From disastrous decor to a global pandemic, Alex Polizzi faces her biggest challenge yet as the hotel inspector, new tomorrow at 9. And tonight, a drunken fall off a bar stool is ending in a trip to A&E after dark as we join our NHS heroes on the night shift next.